So azacitidine and venetoclax has been approved in older patients with AML, and there has been a lot of interest based on preclinical data and based on the activity in AML to explore it in acute myeloid leukemia, on MDS patients. So in this study, we looked at patients who have relapsed and refractory MDS, and we treated them with a combination of azacitidine and venetoclax. So we enrolled close to 70 patients. However, around 26 patients have received venetoclax monotherapy. The activity was not great, so this presentation in ASH focuses on the 46 patients who have received the combination of azacitidine and venetoclax. Among those patients, the median age was 74, so they were older as expected of MDS patients. Most of them had poor risk cytogenetics and baseline cytopenias plus more than 5%, typical features for aggressive MDS. And most of them have received a lot of HMA prior therapy, a median of 9 cycles. In terms of the safety, we saw with this combination what you typically see with azacitidine and venetoclax, which is infections as well as bone count suppressions. However, like with dose adjustment and delays in treatment, most patients have been able to stay on treatment. Only 20% had to discontinue this therapy. In terms of the outcomes, we saw an overall response rate of 39%. 7% was a complete response rate, 32% marrow CR. However, when you look at those marrow CRs and dissect them, around half of them had marrow CR with hematologic improvement, which I think is clinically meaningful. We also observed that 32% achieved transfusion independence among patients who were needing transfusions at baseline. And we saw that the median overall survival was 12 months. At 2-year survival was around 25%. So when you look at all of this data together, I think there's promising activity, and I think this combination should be explored in additional larger, bigger trials, hopefully in randomized fashion.